My name is Joe Shmalo, originally from Sarasota, Florida. Moved up here, opened my first business up here in 1989, and closed all my stores in Florida, Maine, and up here, and just retired up here. And it's heaven. It's just a great place to live, and everything you actually need is here. Maybe not everything you want, but everything you need is in Highlands, including our great hospital. Well, we came back from a trip overseas. We was in Israel, and after the first day home, I was just feeling blah and stayed home all day. The next morning I got up and I just wasn't feeling good. I called my physician, Dr. Baker, and or my wife did, and he on the phone I heard the secretary or the receptionist say 2:30, and I said, no, I got to get in now. So we got in at about 9 o'clock, and his nurse, Deborah, which is wonderful, took my blood pressure, and that was it. She got Dr. Baker, took me over to the emergency room, and after that I don't remember, I was in mission. They did a triple bypass, and I was there 5 days getting my blood pressure up, and then they did my surgery, and I was there 4 days afterwards, and the hospital is unbelievable. The physicians, the staff in the hospital is just wonderful. Professionals that really care about you. I had nurses that I had that came in when they weren't even my nurses when it was on their shift to see me. That means they care. If they come in and see how you're feeling and they're not even your nurse for the day, they're taking their time to check on you, and I'm sure I'm not the only patient they checked on. That means they're not there for a paycheck. They're there because they want to help you. And I think that's really what mission's about, or the whole system is that way. I find it, and I've been there a couple times. My wife's had some surgeries. I'm at this hospital probably, twice a year, 3 times a year. I have a little colon problems, and they have to give me an injection and send me home. They know me by name. It's a great asset to our community. So wonderful that Mission took this over, so we don't need every specialist in town. We have our family physicians, physicians that we need here. We have a great hospital. If you have a major problem, they take you to the best. Dr. Ely did my surgery, and the whole staff there, their whole cardiac staff and their PAs they have are just, when we got home, that's all you have to do is call the hospital, immediately answers, and within a minute, you have a physician's assistant. You don't have the doctors, but you have their assistant. You tell them what's your problem or what's going on. Within 5 minutes to 10 minutes, maximum, we only had to call a couple times, Dr. Ely called me. He personally called me back on 2 little small issues I had. To me, I don't know how you can ask for much better care than that. Only happens in small communities like Asheville, Highlands, small communities. If you're in Atlanta or my town of Sarasota, I'd probably still be in the waiting room. If you have any kind of a problem whatsoever, they can get you to one of the finest hospitals in the country in 12 minutes. They can get you to a specialist so quickly. It's actually better because where you're going is a place where if we had a cardiologist, let's say in Highlands full-time, he might do 1 procedure a month. Where you go to a major hospital, they're doing 12 procedures a day, which does make a difference. I like somebody who knows what they're doing. Exactly like our health tracks here at your hospital. The 2 ladies in there, Yvonne and Mary, they're not there for their weekly paycheck. They are there because they really care about their patients, how we're doing. They care about us, and the volunteers there are wonderful. There is a couple gyms in town, where you can go to personal fitness training, but what you get at the health tracks is completely different. These are people who take your blood pressure, they monitor you, they care, they give you diets. I always was active, but I didn't. I went to the gym 3 days a week, but I wasn't doing cardio. I was just doing weight training, which is good to keep your body in good shape. It doesn't really get your heart going. And I changed my diet. You know, with Yvonne and my cardiologist, mostly Yvonne, to be honest, gave me a booklet, told me what to eat, showed me what to eat. I bring things to her that looks great to me. Then she'll tell me, read the label a little closer, and it's in there, it's trans fat, or, you know. It's just a wonderful staff we have in Health Tracks. If I knew how I was going to feel today, I would have wished I would have had my heart attack 10 years ago. And serious. It's, you know, I always thought I was in good shape, but, you know, I got tired. I, you know, had my times, but I always was active, never missed a day's work. But since my heart attack and my procedure, it took 6 months, 7 months to, it's been 7 months now. It took a few months to get going, but if you stay with the program, you feel better than you did at 50. I actually think I feel better now than I did at 50 years old. But I think I'm the only patient over there that's on no heart medication, no medication. And I'm only 7 months out of surgery. Nothing. I am on no medication. Watch your diet, watch what you're supposed to eat, exercise. Everything's got to be in moderation. If you want to have alcohol, that's fine. You have to do everything in moderation, and you can have a happy life. Every morning breakfast, I make oatmeal. I make it, it's no instant, 25-minute oatmeal, and I put fruit in there, either banana or raisins or pears, whatever I happen to have at the time, and a piece of whole grain toast. Actually, it's yogurt spread I put on it. That's breakfast. Lunch, my wife makes me, we'll have soup that she makes, a low-sodium turkey sandwich or a salad or something. And at dinner, no meat, a lot of fish, and we don't have any meat at the house anymore. I'm getting kind of tired of fish and turkey and chicken, but it's okay. And whenever we go out, if I want to have something else, I do. But I'm actually getting used to not having meat. It's not very hard to change your lifestyle. I was a drinker. I wasn't a heavy drinker, but I drank every night. I have a couple drinks. Ate terribly. Once you go on the table and you don't know if you're going to get up, you will change your lifestyle, so it's easier to change it before it happens. You know, everybody has somebody that they know has had heart problems or have illnesses. Talk to them. If you have any intelligence whatsoever, which I didn't, you'll change your lifestyle. My dad had an old saying that you have to do 3 things every day to have a complete day. You must do your prayers. You must do a good deed, which may be just opening a door for a lady or whatever, and you must learn something. Turn the TV on, you're bound to learn something. If you don't do those 3 things a day, you don't have a complete day. My dad's other favorite saying was, it costs nothing to be nice. It costs nothing to be nice.